ನಮಸ್ಕಾರ. ನನ್ನ ಹೆಸರು ಶ್ರೀನಿವಾಸ್ ಅಂತ, ಪ್ರಸಾದ್ ಗ್ಲೋಬಲ್ ಹಾಸ್ಪಿಟಲ್ ಮ್ಯಾನೇಜರು. ಮತ್ತು ಪ್ರಸಾದ್ ಗ್ಲೋಬಲ್ ಹಾಸ್ಪಿಟಲ್ಲು ಕಳೆದ 4 ವರ್ಷದಿಂದ ಒಳ್ಳೆಯ ಸೇವೆ ಕೊಡ್ತಾ ಬಂದಿದ್ದೀವಿ. ಮತ್ತು ನಮ್ಮ ಪ್ರಸಾದ್ ಗ್ಲೋಬಲ್ ಹಾಸ್ಪಿಟಲ್ಲು ಇಲ್ಲಿರುವ ಬಡವರು ಮತ್ತು ಮಧ್ಯಮ ವರ್ಗದವರು ಮತ್ತು ಎಲ್ಲರಿಗೂ ಸಹ ಸೇವೆ ಕೊಡ್ತಾ ಇದ್ದೀವಿ. ಮತ್ತು ಈಗ ನಮ್ಮ ಪ್ರಸಾದ್ ಗ್ಲೋಬಲ್ ಹಾಸ್ಪಿಟಲ್ ಒಂದು ಕಿರು ಪರಿಚಯನ ಮಾಡಿಕೊಡ್ತಾ ಇದ್ದೀನಿ. ನಿಮ್ಮ ಸಹಾಯಕ್ಕಾಗಿ ಸ್ವಾಗತ ಕೋರೋರು ಶ್ರಾವಣಿ ಅಂತ, ಮತ್ತು ಸುಜಾತ ಅಂತ, ದಾಕ್ಷಾಯಣಿ ಅಂತ, ಪ್ರೀತಿ ಅಂತ. ಇವರು ನಮ್ಮ ಹಾಸ್ಪಿಟಲ್ ಡ್ಯೂಟಿ ಡಾಕ್ಟರ್ ದೀಪಾ ಅಂತ. ಇವರು ನಮ್ಮ ಪ್ರಸಾದ್ ಗ್ಲೋಬಲ್ ಹಾಸ್ಪಿಟಲ್ ಮ್ಯಾನೇಜಿಂಗ್ ಡೈರೆಕ್ಟರ್ ಡಾಕ್ಟರ್ ಪ್ರಸಾದ್.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ.
ಇವರು ನಮ್ಮ ಪ್ರಸಾದ್ ಗ್ಲೋಬಲ್ ಹಾಸ್ಪಿಟಲ್ ಮೆಡಿಕಲ್ ಡೈರೆಕ್ಟರ್ ಡಾಕ್ಟರ್ ನಿಲಿನ್ ಅಂತ.
ನಮಸ್ಕಾರ.
Good evening everyone. Myself Dr. Vikrant Suresh, general, laser, laparoscopic surgeon and a proctologist. Today I am going to talk on some of the general conditions, general surgical conditions, namely anal fissures, anal fistula and hemorrhoids, which are commonly called piles. As you know, these conditions have become very common nowadays because of changes in our lifestyle and eating habits. When these patients comes with any of these symptoms, doing a simple examination can clinch the diagnosis. So nowadays I am treating these patients with a laser technique, which is a minimally invasive and advanced technique for doing these treatments. The advantages of laser treatment in fissures, fistula and hemorrhoids is it is done through very small openings, as it's a minimally invasive technique. So the pain will be very less, the recovery will be fast, so that patients can be discharged early. They can go to their work also early. Along with this, I am also doing laser treatment for bilateral sinus and varicose veins. And I am also doing laparoscopic surgeries for appendicular pathology like appendicitis, gallbladder stones, all types of hernias like umbilical hernia, inguinal hernia and incisional hernias. And also I am doing diagnostic laparoscopy for undiagnosed abdominal pains. So advantages, since the laparoscopy surgeries are done through small openings, pain will be less, recovery will be faster, and even the surgical scar will be very minimal. I am doing all these surgeries, namely laser surgeries, laparoscopic surgeries and other surgeries at a very affordable prices in Prasad Global Hospital, Lakshmipura. So hopefully this information is going to help you so that you can send more and more patients for best and affordable treatment. Thank you.
Namaskara, I am Dr. Sunita T, OBG, IVF and cosmetic gynecologist with 16 years of experience. I finished my graduation from KIMS Hubballi and post-graduation from Government Medical College, Nagpur. Following which I did my IVF specialization and also diploma in cosmetic gynecology. Currently I am working in Manilu Multi-Speciality Clinic, Vidyapura, and also I visit Prasad Global Hospitals, Lakshmipura. Today let's talk about recent advance and newer updates in OBG. So cosmetic gynecology. What is cosmetic gynecology? It is a recent concept. Like as we all know, plastic surgeons will do a lot of surgeries and procedures look and feel good. Similarly, we do procedures and surgeries on vagina and external genitalia for the same reasons. A pregnancy, childbirth, menopause, aging, all these will lead to structural changes in the vagina, which will lead to laxity in the vagina, gaping in the external genitalia, as well as a dry vagina. People who are suffering with all these problems are the candidates for cosmetic gynecology. Now let's talk about what is cosmetic gynecology. Cosmetic gynecology is nothing but reconstruction and rejuvenation of external genitalia and vagina. There are two types, surgical and non-surgical. Surgical such as hymenoplasty, which is nothing but regaining virginity. Labioplasty, which addresses about the size and the shape of the labia. Vaginoplasty deals with the reduction in the size of the vagina. Now coming to non-surgical procedure, which is the latest trend nowadays, where we use a laser or radio frequency energy sources on intimate areas such as vagina and external genitalia. Again, it benefits by enhancing the sexual pressure and also improving on the stress incontinence. If a lot of women they suffer with urinary leakage, it benefits by improving vaginal dryness, and it reduces the recurrent infections. It enhances the sexual pressure, and also it helps in treating the urinary leakages, especially in the menopausal woman. This non-surgical procedure is a day-case procedure. It can be done in the OPD and it is more cost-effective. A recent updates in MTP Act is that earlier we used to do abortions up to 20 weeks of gestation. Now it has increased up to 24 weeks of gestation. And one more update is that Supreme Court has passed a petition saying that hysterectomy under the age of 40 years of a woman has to be with the genuine reasons. Thank you.
Hello everyone. Myself, Dr. Prasad, consultant joint replacement surgeon, sports medicine and orthopedic trauma specialist. Having 12 years of experience in orthopedics, I do deal with all traumas, like from minor trauma to major trauma, all replacement surgeries like TKR, THR, even elbow replacement I do. Even the sports injuries like ACL, PCL, MPFL, meniscal injuries we do, so we address. But I am here to tell you the latest updates. Few latest updates are PRP therapy. In older age group, patient coming with early arthritis, we are giving PRP injections to the knee to get better knee, younger knee, and the much better pain relief to them. PRP improves the cartilage, regenerates the knee. Second update, we all know that older people get joint pains, but now the problem is younger people, even the kids getting joint pains, knee pain, back pain, hip pain, heel pain, and even the sacral region pain. It's mainly due to change in the lifestyle, food habit change, and occupational changes. The patient who is working 24/7, like engineering student patients, they are having a back pain and severe sacral pain. Now they are presenting with carpal tunnel syndrome, trigger finger, and that is causing a major issue in them. And even they are suffering from osteoporosis due to lack of activity. Bone quality is very less in them, and knee pains are more common in those patients. Even the kids are suffering mainly due to vitamin D3 deficiency and calcium deficiency in the food. To keep updated about your health, join me at OrthoCare YouTube channel, and to get an expert opinion, join me at Prasad Global Hospital, Lakshmipura. Thank you.
Hello everyone, I am Dr. Nipun, consultant urologist and andrologist at Prasad Global Hospital, Lakshmipura Cross. So I have been asked to speak about certain common things what we do at Prasad Global Hospital. So one of the commonest topic which I have selected today is circumcision, which is done ritually as well as a treatment. So we have a recent thing what we use, which is called as stapler circumcision, which not many people do, which is done in most of the metros. And I would just like to show you the stapler. So this is the stapler machine. So this is inserted into the prepuce and we just have to fire it. It just takes 5 to 10 minutes. It can be done under local anesthesia, general or regional anesthesia or anything. And it is bloodless, sutureless, and we don't have to cut anything, and we don't have to wait for suture removal. So this will have a silicone ring, and which will usually fall off within 1 or 2 weeks. And this is available in many different sizes. Actually, right from the newborn size up to 34, from 11 to 34, as you people can see. So this is about this, and there will be a video which will follow this, which will show you the procedure of how it is done. Yes, doctors, I am pretty sure that you people have seen the video of the circumcision and you people have liked it. So we'll go to the next topic, which is the flexible ureteroscopy, which is not done very commonly, but we do it. But what we are using right now is not the fiber optic ureteroscope. This is the chip-on-tip flexible ureteroscope, which is used now. So which gives an excellent resolution. So that we can, there is no pixelation, there is no honeycombing effect, and there is as we used to do laparoscopy, as we used to do PCNL, with this actually we can do stones up to 3 centimeters. I have done stones up to 3.5 centimeters. And with thulium fiber laser, what we call it as TFL laser, what we have, the latest laser. So the lasing time for even 2 and 2.5 centimeter stone is just around 25 to 40 minutes. So the complication what we used to see before, so which were sepsis and all those things can be avoided with that. I'll just show you, we'll anyway going to show you the videos, probably in the insert you will be seeing the videos. So this is the hand piece, and this is where we connect our saline, and this is where the saline comes out. We will be working underwater, and when we move this, this tip moves actually, and this is how it goes inside the, I'll show you here, this is how it goes inside the kidney, and the stones what you are seeing, we can directly see this, and we can use send the laser fiber through this. This will have a adapter through which we can send a laser fiber. The fiber will come here under direct vision. We are going to blast the stone. Stones will get powdered and they just come out in the urine. So probably you are seeing that lasing in the main screen where I am speaking in the inset, or probably the video will follow this. Thank you very much. Thanks a lot. Enjoy.
Hello everyone, I am Dr. Smita Vimurthy, Consultant Obstetrician and Gynecologist at Prasad Global Hospital. Today I will be sharing some information regarding gestational diabetes mellitus. Gestational diabetes mellitus is nothing but increased blood sugar levels in pregnancy detected for the first time during pregnancy. The incidence of GBM is around 10 to 14% in India. That is, around 1 in 5 women in India develop gestational diabetes during pregnancy. The risk factors of GBM are advanced maternal age, a past history of PCOS, obesity, past history of GBM in previous pregnancy, and a family history of diabetes mellitus. So it is very important to screen for GBM during pregnancy. The screening for GBM is done at two times, that is, one at the first antenatal visit and second one at 24 to 28 weeks period of gestation. The screening test is a 75 grams glucose challenge test. Here, 75 grams of glucose are given to the pregnant mother irrespective of a previous meal, and blood sugars are checked around 2 hours later. If the blood sugar values are more than 140 milligrams per deciliter, she is labeled as GBM. Now coming to the complications of GBM. Early trimester complications include spontaneous abortions and some fetal anomalies. Late trimester complications are preterm birth, macrosomia, intrauterine fetal demise, stillbirth, and sometimes difficult delivery or instrumental delivery due to shoulder dystocia, lower segment cesarean section, and postpartum hemorrhage. Now coming to the treatment of GBM. It comes in two parts. One is lifestyle modification and the second is extra monitoring. Lifestyle modifications include diet and exercise. The diabetic diet which we advise for the patients include fruits, vegetables, whole grains and lean meat. Exercise is usually advised for 30 minutes a day, which includes brisk walk and upper body exercise. Monitoring is done in two parts. One is the blood sugar monitoring and then is the fetal monitoring. The blood sugar monitoring is done at fasting and post-meal sugars are checked. If the post-meal sugars are more than 140 milligrams per deciliter, irrespective of a diet and exercise, then extra medication needs to be added like metformin, or if still the blood sugars are not controlled, then insulin may be required. Now coming to the fetal monitoring. Fetal monitoring is done by serial ultrasound examinations for the monitoring fetal weight and also the amniotic fluid index. So gestational diabetes mellitus may seem scary, but the baby and the mother will stay healthy if you follow correct advice taken from the doctor. Thank you.
Hello everyone. Myself, Dr. Naveen Anikate, Senior Intervention Cardiologist. I will be speaking on recent trends in intervention cardiology. As the cardiology field has evolved, we have come up with various new therapeutic and diagnostic interventions which is bound to help numerous people throughout the world.
As you people know, cardiovascular disease is one of the leading causes of mortality and morbidity throughout the world. The recent trends are, one is TAVR. TAVR is a transcatheter aortic valve replacement. It is a minimally invasive procedure for treatment of aortic stenosis in high risk and moderate risk category of patients who are not eligible for surgical aortic valve replacement. In this, we usually do a minimally access intervention which helps for the patient to get discharged within 1 or 2 days. Next is adult structural cardiac interventions for patent foramen oval, atrial septal defect, device closures, LA appendage closures for prevention of thrombus formation in atrial fibrillation patients. And coming to the newer invention is, recently in the past decade, radial access interventions are common for therapeutic and diagnostic cardiac catheterization. We do angioplasties and other peripheral interventions through radial access also, which is helpful for the patients. It is just a minimal invasive procedure which helps patients to get discharged on the day of the procedure, and it reduces the risk of bleeding, and it improves the comfortness. There are advances in intravascular imaging like intravascular ultrasound called as IVUS and OCT, optical coherence tomography. This intravascular imaging helps us to treat left main coronary angioplasties or bifurcation angioplasties with accuracy. This intravascular imaging provides the coronary morphology, the plaque characteristics, the calcification, and help to precisely identify the vessel size, diameter, length, and in optimization of the stenting procedures. And it helps to prevent complications like instant restenosis and instant thrombosis. I will be available for cardiology consultation at Prasad Global Hospital, Lakshmipura Road, daily in the evening between 5 to 6 p.m. Like you can consult for cardiology consultation for ischemic heart disease, hypertension, diabetes, and other cardiac related health conditions.
Hi, myself Dr. Nagaraj, pediatrician neonatologist. I have 10 years of experience in this field. I am working in Prasad Global Hospital from past 3 years. Here we have a good facility for general pediatrics, neonatology, and then PICU facility. In NICU we take level 3 care of all the newborns. We can provide care for that. We have a ventilator support and CPAP support in this hospital. We can give a care for good care for pediatric cases like PICU, dengue, all those cases which are very useful for the population surrounded by with minimal amount. Here we have NICU level 3 care where we can manage meconium aspiration syndrome, preterm baby care, respiratory distress syndrome. We can provide a good surfactant care to the respiratory distress syndrome. We can give ventilator support, and we can treat all the cases of sepsis in neonatology, and we can provide a good service for meconium aspiration syndrome with ventilator support, CPAP support, with good nursing facility dedicated to neonatology. We can also manage ICU cases like dengue, CP cases, and then we can provide a respiratory cases like pneumonia, difficulty in breathing, asthma, those kind of cases in PICU facilities where we have here. And we can also have a ventilator support with all the kind of blood transfusion required for the pediatrics, and with specialty care where we can provide a good treatment for seizures. All cardiac cases also we can manage to some extent in this institute.
Hi, my name is Dr. Papraj. I am a consultant ENT surgeon practicing at Prasad Global Hospital. The ENT department is well equipped to provide both medical and surgical care for all the ear, nose, throat problems. We have a well equipped operation theatre where we operate tonsillectomy, septoplasty, gurnoplasty, and foreign body removal, and various ear, nose, throat problems every day. You can consult me for various ear problems like ear discharge, decreased hearing, ear wax, ear foreign body, or any sensory hearing loss, vertigo, tinnitus, and nose problems like nose block, snoring, any polyp growth, or any deviation in the nose, all these problems. We also deal various throat problems like tonsils, voice changes, any growth in the larynx, all these problems both medically and surgically. Thank you.
Hi, I am Dr. Vinay Ramanna, consultant orthopedic surgeon. Fractures in children are very common because it is a still developing bone and not completely mineralized. So, children bones are more fragile than adult bones. The common cause of a bone fracture is fall while playing or doing some sports. So, any bone in the body can fracture, but in children more common is wrist bone, arm and elbow bones. So, symptoms of bone fractures in children are pain, swelling, deformity, and sometimes there may be a wound or bleeding at the site of fracture. This are called as compound fractures, which needs urgent treatment. The first aid for the fracture in children is first we need to stabilize the kid. If there is any bleeding, we should stop it, and then immobilization has to be done using a splint. Even a folded newspaper can be used as a splint, and then icing, keeping it elevated. Then as early as possible, meet the nearest doctor. The doctor will take an X-ray to evaluate the type of fractures. In children, treatment of fractures is conservative with using casts or splints. Sometimes we may have to reduce under anesthesia to get bones in the proper alignment. Few cases may need surgical treatment. Most of the fractures in children heal well with no long-term complications.